Well, why don't you start by telling us exactly what your connection is to all of this?
Yes, I'm Dr. Michael Antoniou. I'm a molecular geneticist conducting basic research in human gene structure and function at a leading London medical school. But I'm also on the Scientific Advisory Council of CREGEN, the organization that oversaw this lifelong toxicity study of GMO corn and Roundup herbicide.
So you oversaw the study when it was underway?
No, I had no connection with the study at all, either in its design or while it was ongoing. I only became aware of it at the end when it was being written up.
But you do know the history and how it started and why it started. Could you tell us how that happened? Yeah.
I do know the background that led to this study. Basically, it's an extension of an investigation conducted by industry and which was published several years ago, and which also formed part of the industry's application for market approval of this GMO corn variety within the European Union. What industry conducted was a 90-day feeding study of this variety of GMO corn called NK603, Roundup tolerant GMO corn. And it based its experimental design on Organization of Economic Cooperation and Development guidelines, OECD guidelines, for evaluating toxicity of chemicals. And it included 20 animals per sex, per feeding group. It had the GMO corn feeding group, which also included the corn with the Roundup, and the non-GM equivalent. And in addition, included some really irrelevant controls, negative controls, which were unrelated varieties of non-GM corn that were also fed to the animals as well. In the study that was published, however, they only presented blood and urine analysis of only 10 animals per group, per sex, per group. Now, this is an important point to bear in mind. So what we have is a study that's only 90 days long, and in effect presented data from only 10 males and 10 female rats during that period. And although the conclusions of the industry were that there were no significant differences between the GMO and the non-GM feeding groups, upon re-evaluation of the raw data, once it became available through court actions in Europe, invoking the Freedom of Information Act, what was discovered was that there were actually highly statistically significant differences in actually 50 parameters between the GM and the non-GM equivalent feeding groups. And most of these differences pertained to liver and kidney function. So there were signs of toxicity to liver and kidney function even after 90 days.
And a rat's lifetime is what, about 2 years, isn't it?
It's about 2 years, that's right.
So shouldn't the study have lasted at least 2 years?
Indeed, if you want to evaluate potential toxic effects over their entire lifespan, which is what you and I are expected to consume this product over our entire lifespan, you should have continued for the entire lifespan of the animals. But I'm afraid that did not happen. The regulators accepted the data at 90 days and accepted it as being safe, even though they acknowledged the fact that there were statistically significant differences between the GM and the non-GM feeding group, but they discarded these differences as being biologically insignificant, which for me is incomprehensible as a scientific concept. But on that basis, the regulators approved the marketing of this GMO corn within the European Union. And this was back in 2003, and the actual peer-reviewed paper with this data was also released in 2004. So basically, Professor Seralini has picked up, in this latest study, has picked up from where the industry left off, which is to take the same experimental design, using the same strain of rat, analyzing the same numbers of animals, but extending it further in terms of adding extra feeding groups. This is to allow a proper dose response to be evaluated from the feed. They also included a breakdown of the components to make so that if there was any adverse effect observed, it would be clear to see whether the GMO was the cause, the Roundup alone was the cause, or a combination of the two. So again, what was unprecedented about this study was that you had 3 test feeding groups: GMO corn sprayed with Roundup, and Roundup alone, all of these at 3 different doses. And when it comes to the Roundup, again, I'd like to emphasize that this is the very first study that evaluated the whole Roundup formulation in an animal toxicity study, rather than just glyphosate, the active ingredient alone. The approval of Roundup use in agriculture and the permitted levels in water and food and feed are based on glyphosate alone, whereas what's used in agriculture and what the population is exposed to is a complex mixture of chemicals, which is the Roundup or glyphosate-based formulation. And the final aspect of Professor Seralini's study, that compared to what industry had done before, of course, was the fact that he extended the experiment to 2 years, essentially the lifespan of the rats in this study. Because the starting hypothesis was, are the signs of liver and kidney toxicity seen in the industry study at 90 days, do they escalate into something serious? And his reasoning, or his belief, was that it was going to be the Roundup that was going to be the cause of the problem. He was not expecting any negative effect from the GMO corn alone, but was expecting some impact from the GMO corn sprayed with the Roundup in the field, or from the Roundup that was added to the drinking water of the animals.
How did this study land in Dr. Seralini's laboratory? Was it the government? Was it he just pick it up on his own devices and raise money to do it? Or how did it land in his particular laboratory?
From an academic interest point of view, Professor Seralini is a molecular endocrinologist and has had a particular interest in chemicals with an endocrine disruptive property that can lead to hormonal imbalances and consequent ill health. And it was from that background that made particularly interested in glyphosate-based herbicides, because glyphosate is a known endocrine disruptive chemical. And so his fear was that these signs of toxicity in the animals, and also experiments that he'd done on human cells grown in the laboratory, were coming from endocrine disruptive effects. Based on these previous investigations, he raised the money to conduct this research himself and his colleagues in France, and it was funded by 2 large foundations within France. And that allowed them, they raised the €3 million needed to conduct the study, and it took 5 years to complete to this point.
And how did he obtain the material he needed to do the study? I assume that Monsanto didn't just turn it over to him.
Yes, it's unknown to me how he got hold of the GMO corn and its non-GM equivalent, but he obviously had the contacts in Canada. The corn was grown in fields in Canada, and very importantly, the GMO corn, the NK603 variety, and its non-GM equivalent, they were grown in the same field at the same time, but with sufficient separation, of course, so that there was no cross-contamination, either of corn and, of course, with Roundup, because you had the GMO corn grown without the Roundup spray, with the Roundup spray, and the non-GMO corn. But they needed to be grown in the same location and at the same time, so that you minimize compositional differences that would be resulting from different environmental inputs.
So certainly before he picked up this study, he did an analysis of the original Monsanto study, right?
That's correct.
And who paid for that one?
The first study was commissioned by Greenpeace, and it was Greenpeace that went to the courts in Germany and won their case to have the raw data released by the regulators. And then Professor Seralini and his team were asked to look at the raw data and see if there was anything there that was not highlighted by the industry.
And do you know what he was expecting to find?
No.
Did he have any expectations?
No, I think he went into reevaluating the data with an open mind. Some parameters that were there were clearly not significant between the GM and the non-GM feeding groups, but clearly many were, and these were not taken into account either by the industry in their interpretation and also the regulators within the European Union when they decided that this product was showing no signs of ill health and therefore safe to consume.
So he obviously saw some shortcomings in the original study, or he wouldn't have gone ahead and done the full 2-year.
Indeed,
Right.
and it's very interesting that actually all 3 varieties of GM corn that were subjected to 90-day feeding studies in rats by the industry, and again used as part of their package for market approval, application for market approval in the European Union, all showed similar disturbances in liver and kidney function. That is 2 varieties of Bt toxin GM corn and the NK603 Roundup tolerant corn varieties. So yes, it was seeing these consistent disturbances in liver and kidney function even at 90 days. There's signs of toxicity. It's important to emphasize that at 90 days, it wasn't as if the animals were falling over sick and dying. No, they were showing biochemical disturbances that appeared to be signs of toxicity, especially to liver and kidney function. Not that there were outright toxic effects, but certainly you couldn't say that the product was safe on the basis of these findings. And clearly what was needed was to extend the study to a longer period of time, preferably for the lifespan of the animal, or at least 2 years.
Really, and
So that's what led that's
So
what
he
sparked the
obvi- he
interest to go ahead with
he
the study.
obviously saw some serious problems and how did he communicate the problems that he saw? Did he communicate them directly to Monsanto, or did he communicate them to the government? I mean, how did he make his opinion clear?
He did submit his findings as reviews to peer-reviewed journals in the scientific literature. The 2 papers appeared, one in 2007 and one in 2009, where he presents that reevaluation of all these 3 varieties of GM corn. And then, of course, this data was presented to the European Union regulators. It was also presented to the industry for their response as well. And both industry and the regulators acknowledged the statistically significant differences between the GM and the non-GM feeding group that Professor Seralini highlighted, but they dismissed the findings on the basis that they were biologically not significant, without qualifying what they mean by this term, biological insignificance. They nevertheless used that as the basis of dismissing the findings as being irrelevant with respect to human health, human and animal health.
Right. So how would you characterize Seralini's findings, what we call the elevator pitch? I mean, the short, clear description of what he found in this study.
What he found were some certain findings were expected, but there were a number of totally unexpected findings from this study.
Which were the expected?
The expected was escalation in the liver and kidney disturbances.
Just because of the time span.
Because of the time. So what was seen at the signs of toxicity to liver and kidney function observed in the industry study at 90 days did in fact escalate to serious harm, especially in the male rats, and resulted in their premature death as a result of kidney and liver failure. The unexpected finding were the marked increase in tumor incidence, especially in the female arm of the study in the various feeding groups. That was totally unexpected. But it was very clear, and what the publication shows is literally the raw data of the investigation for everybody to see and to interpret as they will. But it's very clear that compared to the control group, even though the numbers of animals are low, that there were up to 3-fold differences in tumor incidence between the controls and some of the feeding groups. And this was particularly noticeable in the females. And this was true either with the GMO alone, the GMO corn alone, or with the Roundup alone. The combination of the 2 did not have any additive effect. And that was another surprising finding. Professor Seralini's hypothesis was that the Roundup was going to be the problem, and he was not expecting any detrimental effect on any level from the GMO corn alone. But actually, the GMO corn alone, even at the lowest feeding group, which was 11%, on this long-term basis, long-term consumption, was clearly showing not only liver and kidney functional disturbances leading to premature death primarily in the males, but also mammary tumors and pituitary disturbances in the female group as well. So the increase in tumor incidence was a surprise, but also what was a surprise was that the lowest dose of Roundup that was administered to the animals in this feeding study was also found to be highly toxic.
And that really is a very low dose. I mean, often people who do this kind of research are criticized for overdosing their animals in animal studies, but this was an underdose in a way. I mean, it's isn't it under the human limit?
Yes, the lowest dose that was administered in the drinking water of these animals was chosen because it's what you would find in drinking water, contaminated drinking waters, if you did a survey.
Human drinking water.
Yes, human drinking water, sorry, yes. It's what you would could possibly find in some drinking water. So that's why it was chosen. And it was expected that that would have no adverse effect at all. But shockingly and surprisingly, it actually had a marked negative effect on both the males, but also particularly the female animals. The female animals showed were particularly sensitive to the Roundup that was fed to them, and possibly again because it reflects the endocrine disruptive effect of this chemical, and it's disruptive on the sex steroid hormone system within the animals, and this is the reasoning why you see these negative effects is through that mechanism.
I'm not a scientist, and I haven't seen many of these studies before, but I from the photographs of the tumors, I was shocked at the size of the tumors. Were you? I mean, are those surprisingly large tumors that these rats grew?
Again, like Professor Seralini, I was surprised that there were any increases in tumor incidence at all.
They're huge.
And they were very large. But again, compared to the tumors that arose in the control group, there were marked differences in not only the frequency, but also in the general biology of the tumors as well. The tumors in the test groups, whether they were on the GMO corn alone or the Roundup, they arose earlier in life, they grew more aggressively, more quickly, and there was frequently animals will have multiple tumors, 2 or up to 3 tumors per animal. And again, in accordance with standard scientific practice for this type of toxicity study, when you see tumors arising, you've got to leave the animals alone and just monitor them and see what happens, because it could have a reflection on safety of human implication. And so these tumors grew to very large sizes, and as a result, they caused premature death through organ obstructing. They were non-malignant in that they weren't spreading through the body, but they were growing to very large proportions, and as a result, they were causing obstruction to organs, causing premature death, and also frequently animals had to be euthanized because they reached a point where the tumor was 25% of the total body weight. So in accordance with animal welfare law, the animals had to be euthanized at that time. Whereas in contrast, the tumors that were arising in the control groups were arising late in life, in old age, vast majority in old age, and you were likely to have 1 tumor in any given animal. And the frequency was much lower, up to 3 times lower than in any of the control group and any of the test groups.
And if you were designing a new study, would you change the dosage at all of the way? I mean, that's one of the criticisms was dosage, and the whole incremental impact of the dosage was they feel was not properly measured or not properly administered. Would you redesign the study to change the dosage at all?
Overall, I would not change the design of the study. Again, to be consistent with what industry had done before, Professor Seralini kept the same extreme doses of the GMO, 11% of the diet and 33% of the diet. He kept those 2 and just added the 22% in the middle so that you can actually do a proper dose response. If you've only got 2 measurements in your study, as industry had done before, you cannot establish a dose response. Any scientist worth their salt will tell you that if you've only got 2 points on a graph, it doesn't matter how they relate to each other, you can draw a straight line through them. And you cannot therefore establish a dose-response relationship. You need at least 3 points, which again is what the OECD guidelines recommend, which is why Professor Seralini added the 22% feeding dose in order to give us a chance to see any dose response. And again, surprisingly, there was no dose response. In that, what I mean by that is that the lowest doses, the lowest or the middle dose, gave as much toxic effects as the highest dose. It was a non-linear response. That, again, has been criticized as showing a flaw in the design of the study, but that, again, is missing the point about the possible mechanisms of the toxic effects that have been observed. If they are due to the hormonal system disturbances, which are what are being proposed as the basis of the findings, then actually it's not unusual to observe a non-linear response from a toxic insult into that type of system. Hormonal disturbances can frequently follow what's known as U-shaped responses, where one dose gives you a response and then a higher dose saturates the system in such a way that it shuts it off and you see no response at all. Then you give another dose and you might see an effect reestablished. So hormonal system non-linear responses are very well established in the field, and therefore the findings in this study of a non-linear response and a saturating effect, which is what was observed with both the GMO and the Roundup, should not be taken as invalid, but actually as that's what's happening, basically. This study overall is far more comprehensive and far better than any conducted previously by industry or others. It's more comprehensive in its doses, in its test groups, and it's more comprehensive in the range of parameters. Another of the surprising findings from this study was that the lowest dose of Roundup in the drinking water of the animals was also found to be highly toxic. Why? Because it is at a level that is markedly, very highly below what is currently stated by regulators as being perfectly safe. Just to let me elaborate on that. The lowest dose of glyphosate equivalent of Roundup in the drinking water was 0.1 part per billion. 0.1 part per billion of glyphosate equivalent. The permitted level of glyphosate within American drinking water is 1,000 parts per billion. In other words, 10,000 times higher than the dose found to still be highly toxic in this feeding study. In Europe, we're a little bit better off. The permitted level in drinking water within the European Union is only double the dose that's still found to be toxic in this study. And why? It's because what's been tested here is the total Roundup formulation rather than glyphosate alone, which is all that was tested previously in animal feeding studies to evaluate toxic effects. And so what this study is telling us is that at the moment, we don't know what the safe level of glyphosate-based herbicide is in our water and feed, because even the lowest dose in this study was still found to be highly toxic. Either way you look at it, the levels currently held as safe, either in the United States or within the European Union in water or feed, are far, far higher than where they need to be. And so the whole system in that regard needs to be reevaluated.
The European Food Safety Authority and the German Institute of Risk Assessment both dismissed this study. Were you surprised by that?
I was not surprised that both the European Food Safety Authority and the German equivalent body dismissed this study, because for two reasons. Firstly, the European Food Safety Authority was the body that evaluated the data of industry based on the 90-day feeding study and accepted it as showing safety, and therefore passed it and approved it for marketing, both of this variety of GMO corn, the NK603 corn. And it was the German regulators that passed the levels of glyphosate-based herbicide in water and feed far higher than what have been found to be toxic in this study, again, as being perfectly safe levels of exposure. So in order for these two bodies to really acknowledge this study, they would have to say that they got it very, very wrong the first time round when they took the industry data and accepted it for their interpretation and said that it was perfectly safe to consume these products at the levels stated. And I'm afraid, based on this possible conflict of interest here, I did not find it at all. The reasons that were given by these two regulatory bodies for dismissing this study, well, I did not find, again, they criticized it really based on what others had already published, which was the strain of rat used, the numbers of animals used. Just to give you an example, the European Food Safety Authority says that there weren't enough animals used to evaluate carcinogenicity. Again, missing completely the point that this was never embarked on as a carcinogenicity study. It was a toxicity study using perfectly adequate numbers of animals in that regard, which happened to find an increased level of tumor incidence as presented in this study. So this shows that they haven't actually acknowledged this study for really what it is, and therefore trying to protect their original decision.
There have been quite a few scientists who actually support this study.
Indeed.
And any surprises there, or do any of them, some of them stand out more than others in terms of prestige, in terms of helping support the study itself?
I think what we've seen is that given sufficient time to allow an evaluation of the paper, we have seen more and more scientists individually and as organizations, such as the European Network of Scientists for Social and Environmental Responsibility. We're like the European equivalent of the Union of Concerned Scientists here in the United States. Having evaluated the study, looked at it carefully, they have come out with supportive statements and highlighted the flaws in those who have the reasons that the critics have used to dismiss the study. So I think I would say that any impartial scientist who looks at this study carefully will realize that, yes, it's not perfect because there's no perfect study anyway. But there are so many things going on, so many parameters that are being disturbed in the functioning of these animals, including the increase in tumor incidence, that you cannot dismiss it. There is clearly something going wrong that is linked to the GMO alone and the Roundup alone at very low doses indeed. And at the very least, the conclusion you would come to is that we'd better follow this up carefully, because the implications are enormous. The implications are that most people in the world are going to be affected because vast numbers of people around the world are exposed either to the consumption directly or indirectly of this GMO, but also to the Roundup-based or the glyphosate-based herbicides.
I was surprised when I was researching for this, the number of research projects that have been done around the world on GMOs being fed to animals. I became curious to know why this one seems to have jumped onto the front page. I mean, this was published in over 400 publications around the world. Why? And the other ones seem to have found some similar negative effects of GMO and genetically modified crops with animals. Why did this one jump onto the front page?
I think because this study is unprecedented in that this is the first time that this particular variety of GMO crop has been studied on a long-term basis in an established human toxicity rat model system. And it's the first to try and distinguish any adverse effect that may be observed, to distinguish whether that adverse effect is arising from the GMO or the Roundup herbicide that's applied, or a combination of the two. And it's the very first of its type to look at the whole agricultural formulation of Roundup. Any study looking at this glyphosate-based herbicide in the past has only tested glyphosate, either in cells growing in the laboratory or in short or long-term animal feeding studies. They've only looked at glyphosate alone and not Roundup formulation. And therefore, the design of this experiment, duration, and its components is unprecedented. And the results, of course, are very striking, unexpectedly striking, I should add. And that's why it's probably caught the attention of everybody far more than previous studies that have been conducted, which also showed signs of toxicity. Previous studies with GM corn in laboratory animals over a short and long duration have focused on the Bt toxin GM corn varieties. This is the first one that's been done with the Roundup tolerant GM corn. And clearly it's possible that the two different varieties of GM corn may show different toxic effects in a long-term evaluation of this type. What's clear, however, from this study is that the implications are that we'd better evaluate all GMO crops and foods lifelong, 2 years, in a good rat model system of this nature before we can call them safe to consume on a long-term basis or not. A major component of this study that makes it unique is that it's the very first time that a whole pesticide formulation, as used in agriculture, has been tested for toxicity. What's happened previously is that only active ingredients in a pesticide formulation, for example, only glyphosate when it comes to Roundup formulation, has been tested for toxicity. In this experiment, in this investigation, a whole Roundup formulation has been evaluated for toxicity. And the worrying thing is that the Roundup formulation, with all of its added chemical components, its adjuvants or surfactants as they're called, has been found to be far, far more toxic than just glyphosate alone. So the implications are that we need to be evaluating all pesticides as a complete formulation and not just active ingredients, because they may pose a greater health risk than the active ingredient alone.
Michael, what would you say is the take-home message from all of this for the consumer of genetically modified organisms and foods? And that's pretty much all of us.
Indeed, this is obviously the ultimate question, really, because what are the implications of this study for the public? Firstly, there are major regulatory implications. What this study has highlighted are inadequacies in the regulatory system really around the world, not just here in the United States, but within the European Union and other nations around the world, in that what is currently used to evaluate the safety of both a GMO crop and of a pesticide used in agriculture are inadequate. It's obvious that we need to do lifelong evaluation. We need to also look at whole pesticide formulations and not just active ingredients. So that's the first implication. The second is that given the findings of this study, it is for me obvious that we need to reevaluate the safety of both GMOs, all GMOs, and pesticide formulations to evaluate their safety properly, to find out what is a safe level of long-term consumption or exposure of these products. We could go further by saying that actually, until these long-term studies have been conducted to evaluate the safety of these products properly, that at the very least, there should be clear labeling of these products so that the consumer can make an informed choice. For me, at the very least, based on this study, I would withdraw approval of this particular GMO food because its safety has been called into question, for me, without doubt, based on a study that is far superior to what industry conducted previously and upon which safety was concluded. And over and above that, if we don't want to outright ban the use of Roundup-based or glyphosate-based herbicides, we should be lowering, drastically lowering the permitted levels in water, food and feed based on this study as well. Now, if to achieve a drastic reduction of glyphosate-based herbicide in water and feed, we have to think of basically stop using it, then I'm afraid that so be it, because we have to put the safety, we have to take a precautionary approach and put the safety of people first and foremost.
Is there a takeaway message from this whole experience that we're talking about here for science and practicing scientists?
In this field?
Yeah.
Or
yeah,
science
no,
in general?
Yeah, no, let's just stay with toxicology. Are there lessons, has science learned a lesson from this?
For scientists involved in the field of toxicology, I think there are a number of lessons that can be taken from this. The need to always conduct lifelong investigations and also whole pesticide formulations in toxicity evaluation rather than simply active ingredients that are present in these chemical formulations. Because in the past, this has simply not been the case.
What is your own position on genetically modified organisms and genetically modified foods? Do you have a position of your own? Or?
For me, genetic modification, genetic engineering is an incredibly valuable tool. I use it virtually every day in my laboratory to investigate human gene structure and function and contribute to the development of human gene therapy medicines, gene medicines. I feel that the safe and responsible use of GM technology, acknowledging the fact that it can have gene disruptive effects and therefore unexpected undesirable outcomes, is under what we call contained use conditions, contained clinical use, contained industrial use for the production of valuable pharmaceuticals. I feel the way that GM technology is being applied in agriculture is not a sensible use of the technology because it does not acknowledge the fact that it has invariably, to a lesser or greater degree, a gene disruptive effect. It brings about combinations of genes that have not evolved to work together. Basically, the combination, the overall effect of the GM transformation process is to bring about combinations of genes and chemicals that have not existed previously and pose serious new health risks that have not, up until very recently, with this Professor Seralini's study, been properly evaluated. There's been a disservice to the people. The kinds of studies we're seeing done now by independent researchers like Professor Seralini should have been done before market approval, and yet we're seeing them now many years after people have been exposed and consuming these products.